Hi guys. Good morning guys. Kumusta kayo lahat dyan guys? Biglang shoutout Manilin, Jonathan Pasaporte, ayan. Manilin Umandap. Sino mga nandyan guys? Romley, may galamig shoutout. Irene. Regards ako kay mami guys ha. Sabihin nyo ano. Mami C. Jessica Salomon, Foodloggers TV. Janet, magalamig ka shoutout. See you mamaya guys. Miss tutorial. Kay Lorena, magalamig ka shoutout. Rowena. Jeline, net ko na. Hello. Toldani, may galamig ka shoutout. Nandiyan si Toldani guys. Just Wise, Ate Desai, Sangga Boy, Ate Ron, Sir Julius, BP, may galamig ka shoutout. Ay, nandyan kayo. Catherine, may galamig ka shoutout ka. Christina, Sama tayo sa loob, guys. Sama ko kayo. Diba? Kay! Hello, nandyan si Kay? Papasok na ako, Kay. Saan ka na? Lika na, Kay. Mimiss na kita, lika na. Kay! My God, sana si Kay. Thank you, Kay. Namiss na kita, lika na dito, bunso. Lika na. Pasok ka na. Kay, lika na, Kay. Ladumi ng ano ko, insil, dali kabuk. Samahan niyo ko sa loob, tara. Ang dungis naman ito. Teka lang, guys, ha. Ang dungis naman. Tara, sama tayo sa loob. Ang dungis. Ay. I will bring water. Oh. Assalamualaikum. Brother, where is for the sign in? Sorry? The blue? Where is for the sign in? Here? GLS. Okay lang. Dili ka lingkod, oh. Katubang ko dayo, oh. Dili ba, oh. Bisaya tayo ka? Oh, Bisaya.
Ilong ka ba? Bisaya din ba yun? Oo. May pagka-Bisaya.
Sabay-sabay. Kasabay ka sa BLS, no?
Oo. Picture ka? Iba yung picture ko din. Sige na. Dali mo, baka may maraming pera niya. Sinabi niyo, wala pa may pera, kaya nga iwan kayo sa mga iwan lang. Ayaw ka na iniiwan. Kung may pera, di na madala. Oo. Kung may pera, dali namin. Kung may magkara ka man sa okay. Labas tawo. Hindi po, labas tawo. Basta sa discount, di ba? Hindi po lang buwan. Ada lang, ada dudukong yung Dede kan jadi dede waktu di kelas. Itu awalnya saya orang bulan dasar awan
Dito ka na ba? Really? Wow. Dito tayo, like ba? Wala mang tao dito. Si Kay. Ito si Kay. Layo mo eh, dito ka oh. Hindi. Hindi yan. Ang lalayo ninyo, like ba? Ayos lang. Oh, say hi ka muna. Ito na ako, guys. Ano yung gagawin, Kay?
Ano tayo? Practical lang tayo.
Practical tayo ngayon? Ano yun?
Range of motion.
Tapos na na-demo ka po? Na ano? Na-demo na? Hindi pa.
Ngayon pala itagay. Konti lang tayo kayo okay lang pala to. Sa Monday class, ano yung ginagawa nila? Alis sila.
Ayun, Kay. Lagay mo nga dyan, Kay. Dito? Sa akin na itutok.
Oh, ayan. Sa'yo ang tutok. Teka, ikit na
Ito
natin.
sa tabi ka dito sa akin, bro. Kasi mami siya. Tutok lang yung sa akin.
Ayaw po dito sa hati.
Dito ko ba eh? Parang maintindi. Madali.
Hi everyone. How's everyone here?
Tuldani, dali. Isa pa tapos tuldani. Ano ba?
Dito. Ano ko tapos bigla ba naman yung kalahati ng katawan ko, di ko maigalaw talaga para siyang mamaliit. Tapos talagang sabi ko sa mga nagpakiramdam ko, di mataas ang tagas ko. Kaya tumawag na ng ambulance. Pinasok sa bahay kasi nakita mo yung pagkagalan yung pagkakagawa. Kung tumawag sila ng ambulance. Oo, kumuha sila ng stretcher, dalawa, tulong silang binuhat ako, sinakay sa
Hospital na kada.
Ako nangyari, sir. Tatawagin dito, sir, ano ba nangyari kay? Sabi nila sa ospital ako, hindi nakakanaano kasi nag-busy sa kakas.
Hi guys, ala, pulang-pula mo yung lips ko, pero hindi na akong tissue gyatan. Wala.
Nag-ano ako na, yung Pfizer vaccine kasi, nagpa-vaccine ako. Tapos, ngayon, after nun, sabi ko parang medyo mainit yung katawan. Yung ganito ko talaga namamanhid siya. Hindi ako makagano sa kama. Tapos nag-asan na lang ako. Yung tiyan ko, alam mo yung parang pinipilipit na di mo maintindihan yung pakiramdam. Hindi ko na alam. Ako ko isang selfie. Sabi ko, kuya, hindi ko may galaw yung katawan. Sabi ko, what's going on? Sabi nga dahil sa after ng vaccine, nagmamadali sila sa Pfizer. Ang sakit ba ng lakas ng Pfizer? Nandun ka ba ng time na yun? Nasa ano ba sa bahay?
So, inano ko ng ambulance?
Oo, pumasok din sa bahay. Alam ni ate yung structure ng bahay. Ginasok sa ko. Dalawang binuhat nila ako sa stretcher. Buti magaling.
Sige, kahit tinatawag yun dito, sabi mo, tayo nasa hospital. Hindi ko naman sige. Sabi, practical na magaling ako.
BLS pala kayo kapon.
BLS yun.
Ikaw hindi.
Hindi ako naka-attend eh. Kanina umagalaw ako there. Sabi ni Doc, pahinga ka, sabi ko hindi.
Magandang BLS, no? Sino nag-train sa inyo?
Si Sir Percy ka din. Siya ang bada, Percy. Si Sir bada.
Percy.
Then they also
Yung nandito rin na before, yung nag-training sa dito.
Yung maliit?
Oo na.
Yung pugi?
Oo.
Na maliit?
Kalbo na siya ngayon.
Kalbo ba?
Nakalbo na siya.
Or nagpagupit siya ng pero magaling siya hindi ka naman matatakot.
Magaling siya maturo ng...
Tapos may exam na 1 to 30, wala naman ako sa top 3. May top 3, sabi ko, ikaw na.
Oh.
Anong exam yun?
Yung ano na
Galing lang din doon. Kung ano yung pinag-aaralan.
Kasi kasi ang laki. Si Brenda ang number 1 top notcher. Si Brenda, wow, ikaw.
Brenda?
Kaya pala tumawag din sa akin kahapon.
Sabi niya, oo, nagtanong niya sa pagpasok ko, where's Kay? Is Kay coming? Sabi ko, no, not sure. I need to message her. Sabi ko.
Lahat hinahanap na. Pero kasi natawag din sa akin. Ano ba yun?
Oo, tanong lang talaga sa message. G, nandiyan ako yung lahat. Sinong wala pa? Eh, nag-i-start na yung klase. Tapos, tinitingnan ako yung staff. Sabi ko, sige nga, silent ko muna. Si Melvin din late.
Diyan mo si Mami. Guys, nandyan si Mami, guys.
Hi,
Itutok nga natin sa atin. Hindi mo magalit yung mga itim.
saan natin yung siya? Okay ba sa'yo, Kay?
Init kaya.
Huwag naiinit.
Ito si ate.
Hi!
Hi.
Bakit tayo?
How are you? BLS.
yeah, oh my god. Where have you been?
Just say hi to my vlog. Oh, how are you? Wait, where's your friend?
My friend, she completed already.
Oh,
Yeah.
she get
She was doing
the
caregiving, so she's doing it.
she have the certificate.
Iba yung hinihiling na.
Adduction. Adduction.
I'm so happy seeing you.
I guess no.
Pronation, supination.
Sa BLS ko rin yung nagiging classmate. Pati to.
Galing na. That's right.
Parang ito din, mga BLS yan. Hakas na ha?
Hindi ko siya makapasok.
Nasa is multiple practical.
Hi guys!
Paano malayo? Wala na po.
Hindi pumasok ko, sabi ko pupuntahan ko sa bahay, magisingin kita. Kakatok na lang ako.
Ikaw ba yung nagbalipad kanina?
Oo.
Abidjan, hi, say good morning. Dati yung Abidjan school.
Yes. Yung mga yun, nung pinapinanong ko, yung mga nag-forward
Hindi ko na nasa luwas ang dalan mo na po na yung na sa angkos.
Tatay ko ba?
Eh, hindi mo sa ko na sa Friday ko yung practical. So yung when I was at work in Venice. I you saw mo.
Si Christine hindi papasok.
Hindi. Si Mia. Hindi dahil kasi si Mia sa Friday. Friday lang daw available. Tapos si Christine. Pasok niya sa Mia. Hindi pa pa na lang siya. Kaya ang papasukan yung Monday. Monday. Ganun pa rin tayo. Tapos yung iba hindi ko alam kung wala na tayo. Ay, sabihin na lang tayo.
Pwede naman si ayaw mo pumasok sa Friday.
Pwede, sige. Pero pasok ko Friday. Minsan kasi wala sa Friday. Hindi kasi hindi nila.
Pasok tayo. Para sa si Nelvin. Ito si Nelvin. Siya may sabi papasok siya ngayon. Tapos yung wala ko.
At tinatanong ko nga eh, pumasok kasi siya ng Friday. Kasi nga wala pa siya hindi. Kasi nga last week kasi, meron silang date ng misis niya. Anniversary. Sabi ko sa kanya, sana ako nag-anniversary. Sabi niya, di ako kasama yung sis sa anniversary. Sabi ko kasi niya, happy anniversary na lang. Sabi ko, bro,
Because the light was not take pictures of everyone and the one strong point is putting very good na tayong lahat kasi naka-uniform. Ay, so wala klase na?
uy, na tayo lahat.
Shout out to din yung cellphone. Hindi mo makita pala. May module ka na?
Ito,
Bagong module ba yan?
alam mo ba, ano hindi ka naman inaten. Ito, pinagpapabigay ko pala sa'yo. Yung module 4. Yung ganito pa rin. Hindi pa, alam pa tayo ano na tower tool. Staff, pero wala sa
Saan dito yung kit?
dito, hindi ko sure.
Providing care? Ito ako
Meron ka ganyan sa module 3. Ito kasi yung dito. Geometry ka na? 3. Ito yata yung gagawin natin. Ito ba yung gagawin natin? Learning and organization. Ito siya.
May nagawa na kayo practical ba?
Yes, puro
Ito,
nandito
ito
na
na practical ito.
wala pa tayo lecture.
Ano iba yung nagiging practical?
Ito yung ginawa
Di ba tapos na tayo sa
Ito pa lang yung ginawa. But coming back here, ito yung last weeks ako.
Yan yung na-miss ko.
Na-miss mo dati. Saan ko po ba yan? Ayan, thank you sa tapos ito.
Ilang practical na ba kayo?
Ito yung ginawa dito.
Nakadalawang practical na kayo? Na hindi ko nasabang.
Dito ka ba nung saan? Dito ka nung tayo sa
Insulin.
yun na, dalawa pa lang. Ito. Wala pang discussion eh. Di ba ako naka-attend ng discussion? Saan ka ako nasa ROL? Ito ba yung range mo? Ito ba ito? Ito tayo. Tapos, ano ba yung ginawa? Ito naman yung last name NGT.
Done mo na yan?
Tapos na. Pero hindi naman niya diniscuss din kasi. Nagano kami direct kami pinapakain niya. May sa gastric feeding. Lang siya. Kasi 2 hours lang kaya ako. Kumari na tapos na natin. Practical. Pwede na umuwi. Ito tayo ngayon.
Marami din sila sa CG. CG.
Kasi wala ang ganito. Wala kami sa
Ano yan? CG, ano yan? Single lang ba? Walang kita ko.
Di ba nasi ko naman yan? Meron? Inatin ako nga yun. Kasi nakita ko nung class na to. Nagsikin ako dyan. Hello ka pa? Inatendan mo doon.
Dito tayo.
Bukas kayo, pre ka, hindi. Kasi ano yung CG class? Meron. CG class, ano daw? Personal hygiene. Pwede masukan niyo, sabi ni Mami. Nasok mo sa dati nating stairs. Sino yung mga nandun? Nandun pa rin yung mga dati. Yung mga bagong na iniwala natin. Wala. So kaya yung sila yung nature na partner ni ate. Hindi, yung makagay. Ganda na. Ay, wala. Hindi mo nakakita. Ay, bayad pa lang. Tapos, tayo nandun sa parok. Dami nila si CG.
Madami na sila.
Single CG. Ang sayo nato na nag-incur ako na create yata. Iba single lang. Tapos dito walang partner.
Yan?
Oo, isa-isa.
Ito.
Si Isa-isa kami nag-perform last week.
Pasok ka na ba yan?
Hindi pa, ito yun ngayon nagagawin natin.
Parang continuation lang.
Continuation ng practical. Pero wala pa talagang discussion. Diba?
This one,
Simula nung nag-attend tayo, wala tayong discussion. Hanggang ngayon, all to trip.
Direct practical ay sa way na.
Mabait yun siya.
Practical daw dito ka.
Isa si ate yun sa'yo. Sabi nga namin ni Akin eh.
Oo, si Len.
Gusto ka na.
Ganito ka dapat, uy. Uro ka kaya dito na. Uro ka dito sa uwi ng sapatin.
You try to write that that's mistake. You try to write that
Kayo ba dapat?
and reducing it and the rest is for
Ito ka na lang lino sa that day. Kasi natin yung kuhan ni Mom Elsie. That's it. I ordered.
Galing naman ni ano.
Dito na lang ako.
Baka kalpangan lang ako.
Galing naman ni...
Dahil isa lang tayo. Sabi ko, anong score ko dyan? Bagsak ba ako dyan? Hindi mo tinignan yung score. Hindi ko rin tinanong kasi nagmamadali. Nagalit naman kami natapos.
Ay, kumain hata dito. Hindi na,
Bawal ang tissue.
hindi na ganun.
Diyan na si Ma'am Elsie, guys.
Kami natin today.
Andiyan na yung...
all of you are in uniform, no?
Uy, magpanyo, yes. Na-miss ko si Lynn.
Welcome back, Jo.
Dalawang practical, nag-BLS ka na?
Nag-BLS na tayo.
Ay, oo nga pala. Si ano pala yun, sila Nelvin. Lynn. Tagal ba? Ano na eh, nagtampo na.
Kasi nung pinanood ko yung video, marami pang hindi lang itong talaga ba? Oo. No.
Si Weng, guys, oh, ayan si Weng.
Hi. Welcome back.
Na ganyan nawala. Gusto ko, sayang kasi. Tapos pa rin naman.
Nakakamiss. Yan na guys, nalirito na kami Ma'am Elsie ulit. Ma'am Elsie.
Hi ka na. Pwede mo sumapa din.
Hindi ko maganon yung sakit.
3 days.
Dito ko lang.
Today is duty or what?
No, we did NGT last week, ma'am.
I did. Range of motion.
Kalimutan ni Ma'am Ellen. Baka may ganito pa kasi. Family. Hindi eh. That's the position ko eh. Diyan ka talaga. Ha? Diyan ka talaga. Hindi, pilipat ka talaga. Masyadong na-miss yung ate ano.
Ay, kaya ko lang si Nelvin.
Chinek ko na ito ka lang. Saan kaya?
Lynn, we will have picture taking now. We're wearing uniform, ha?
Ang dami natin.
Naku, God, I didn't know how to use it. Ano po sa mo? Option.
Module 3.
Parang kulang yung page.
Oo, wala yun. Wala. Kaya i-ano ko sa ano. Sa
Wala
video.
talaga yung
Wala siya talaga. Oo, i-ano ko sa video.
pero kailangan ko lang yung page. Ah, okay. Simula na nag-prepare tayo ng klase. Hindi pa tayo nakausap.
Oo nga. Ano na nangyari? Done? Finish? Tapos na? Imbasil. Imbasil.
Kunting po siya lang sa March na check-up.
Bakit parang anong boses mo, Jo?
Pausang ko. Kakalive.
Gano'n,
Oo.
nagsisigaw na
Kakalive.
Nag-perform na.
Namaos.
Performer kasi kung si Ate Jo. Singer.
Birthday ba ni ano? No, Daddy C?
Oo, sanay.
Akala ko na isang araw.
Tapos birthday ko sa Ter.
Malapit na birthday nito.
Invite ko kayo.
Ay, February ka din?
13 siya. Hindi pa kasi naktong 14 para balik pa yun.
Ah!
Saan ang celebration?
Sama kayo.
Saan ba yan?
Ano eh, doon sa classmate, doon sa ano eh, alam niyo sa salon, ma'am, sa accommodation.
Yung pinag-anuhan niyo ng
Kasi, naalala mo si Mami Juicy, yung medyo may edad? Birthday doon sa salon? Tatlo kami birthday sa salon ng February, guys, sabi ko sabay tayo.
Ah, doon sa compound nila.
Sa accommodation lang, dito sa ano, Altuba. Malapit lang sa'yo.
Ah, okay.
Nung nag-celebrate ka ng New Year?
Doon.
Oh, doon sa kanila.
Oo, sabi mo, di ba may birthday ng
Kaso may live ako ng ano eh, ng umaga hanggang gabi. Tapos pag out, kasi out sila ng salon. Sabi ko pag out yun na lang. Oo.
Flexion, hypertension, extension, rotation. Lahat sila may connection.
Okay, group yourself into 4.
Four?
Ito Gusto kayo?
Hindi ka sasali?
Ang dami.
Group yourself into 4 and you have your handkerchief.
One only, ma'am.
Oh. Anything that can cover your mask you can we will ask
Ganyan.
you have extra mask.
Muan style yata kami yung ulit eh.
You have extra mask.
Style. Ano nang nangyari? Bakit? Saan? Ay, gusto mo
Tapos sexy ka ba? Bago magano? Bago ikasal? Bago kasal? Hindi, ano lang. Kasi kailangan namin nakakaramdaman sa calculation.
Hindi ka nagpaano? Pero nagpa-baby ka.
Hindi pa naman. Pero parang ano kasi yung katawan ko tamad na tamad. Kaya nag-try ako mag-cardio ko.
Oo nga, sakit.
Oo, yun po. Nagagalaw mo lahat ng katawan. Hapon dito lang. Kasi ko
Parang ano na, parang ang pinilayan.
kailangan ko ng masahe. Yung kada di ba ang ganyan ang katawan ko, may tumubo.
Mask ang itabon sa sa mata.
Ay, ganyan ata ulit. Matulog. Matulog. Di ba pag natulog ka,
Meron kang eye mask.
Wala na ako nakita lalo.
Meron ka?
Meron akong ganito, pero
ganyan. Tulog na.
sasakyan. Eh, kasi dala
Tulog na kaganyan.
Pero wala ko. Baka wala ko. Dami ko naman. May takton pa. Wala naman. Andito.
Buti mo na ako, Paki.
Bumalik ka na rin kasi.
Kaya nga.
Hindi ko na maalala. Bumalik na naman. Hindi ko na wala ko na outcome.
March 24. Ano na yun? Yun na yun siya.
Oo, yun na yun.
Sa Imasigan na.
Sa iwas.
Susama kami.
Kasi, actually baka lang ko nga, parang dalawa lang.
Okay, then I'll show you first how to
Kasi,
group yourself into 4, then go here in the back.
Sinilwe.
Yeah.
Ilan tayo to 4 eh?
meron pa dito.
Para mabilis tayo.
Kasi ganun, we're 4 already.
Sakto. Okay na.
Ikaw may ka-group si...
Ano may group si Ate May?
May ka-group ka na? May ka-group ka na?
Sige, ilan ba?
Okay, Roweng. And you and who else?
Ay, follow ba?
Ate Jonah, meron ka ng group? Meron ka ng group?
No payment.
May group ka na?
Oh, sila ba?
Pag-abot ako.
Hindi
Di ba
ba
Pwede pa ito swimming sa akin.
Di ma? Pwede sa iba. Brother, you have group already? You have your group? Meron kasi ako sa labas. Kasi bro, bakit ako kasi nanginigil agad ka lang na? Pwede ako yung basta lang maningin?
Hindi ka mapapasok eh. Wala ka naglayas. Giving your rules sa rin. Wala ko siya.
Pinagano ko yung video eh. Yung alin?
We never pay. Okay? That's important to us. We
Ito. Yung sa ano ni Ma'am LG. Reshoot motion.
Ito nga, pero parang ang kulang. Sabi lang.
Ibawas ka ba ng CG certificate natin? Oo, wala pa rin. Wala pa. Pero sila ka meron kasi wala sila pang CG talaga yung sila. Tapos nag-book sila. Meron na sila. Pero mga parang last 2 months ago pa nila pinag.
May tumawag sa inyo? Tumawag sa inyo.
Ako sana tumawag.
Pinabak ko yung last week, sabi 1 week pa. Eh, di ba? 1 week.
Tumawag sila sa akin, tinanong ko yung certificate na printing.
On printing pa.
Paano yung graduation natin sa CG?
Sana ba yun?
Crazy, may galang gisa. Crazy.
Wala, second week nung usapan na yun.
Who has no mask? Use this to cover your eyes.
Cover your eyes.
Hindi mo tayo. You have already,
I have this.
you have. Okay, so, you already group yourself to 4?
Yes, miss. If lacking, just call me to add your group.
How many groups? Maybe 4 or 5?
Maybe 2 will be
80.
Independent.
Dalawa yung ano.
Yeah. That the 2 extra will join any of the group.
yeah.
Oh, dito na
Okay?
Pwede naman, okay.
Verse 6, ma'am.
Put this one here. 6 po
To cover your eyes. Later, yeah, you will go here in front, cover your eyes, and you will do like this.
How we know if we cover our eyes?
Yeah, that's why you have to memorize those ways of motion.
Ganun. Parang blind tayo.
Blind ring may angat.
How many groups? 5?
4 man.
4 lang.
Okay.
Magbulag-bulagan kami guys. Pag-ibig.
Lynn,
Hindi kami sa pag-ibig na bulag-bulag. Bulag-bulag.
How many groups?
4 daw eh.
4 groups.
But you have to, I'll show you. No more, this was done by Fabi, one of the CNA students, and she's also working in the home care right now.
Wow.
Before, she's working in the school.
Ma'am, wala.
We will put sound.
Wala po sa ano man. Walang lumalabas pa.
Put sound.
Ang cute naman. Ang cute naman. Parang mouse lang.
Nailaw ba yan? May ilaw ata to.
Balik tayo lang.
Good.
Guys, I have to,
Lin sila. Meron na.
supination,
Yeah,
okay?
you're
Supine and prone, okay? Supine and prone, but the rest is okay.
Sabay nakahiga. Dapa yung pro.
Yeah, but for the hands, you can do also supine.
Supine, supine, supine,
Pronation,
Prone.
supination. In module 3.
Ayun, meron na.
Siya yun.
Yan, si Feb.
Naka-stop siya. Ay.
External rotation.
External rotation.
Internal rotation. Abduction. 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 Elbow flexion.
Nakakalimutan na rin natin.
Elbow extension.
Oh,
Ang sarap nito. Supination. Parang
pronation.
baliktad yata yung baliktad.
Baliktad yung, di ba pala yung pronation?
ulnar rotation.
Rest flexion. Rest extension. Finger flexion. Finger extension. Nail extension.
Sir, sakit mo ka gano'n?
Hip extension. Hip abduction.
Hip adduction.
All time exercise.
Adduction.
Hip abduction. Twist manuka.
Yung internal
Internal rotation.
external. Ang madali lang.
Nail flexion. Arte. Arte extension.
Ano to?
Dorsal.
Tapos gano'n. Ating kaya.
Okay. Now, 4 of you will stand here in front. Okay, the judges will be your classmates. And okay, I will do, let's say,
Pronation.
leg flexion or extension, then you have to do it. Okay? Your classmates will be the one who will judge.
Sabi ni Wing, paano mo sabihin pag yung extension?
Okay? Yes, yes. Isa ka daw ng
Neck.
Ah.
Muna ba kayo, Ben?
Hira lang natin ito kay Ma'am Elsie kay Ma'am ito.
Lateral flexion. Ang sakit, hindi ko kaya yung ano, ikamat to. Ganun.
Pwede ba namin kunin Miss Elsie yung video na to? Meron sa ano na YouTube. Sa ano sa iba din mo?
Flexion to ata, di ba? Adduction. Abduction, adduction.
With
Elbow flexion. Tapos isa.
Parang pareho lang.
Flexion. Flexion tapos extension. Ano yung supination? And then yung pronation.
Baliktad mo yun.
Ito naman yung gano'n, under the age. Puti ka sakit. Radial deviation. Ito yung disservice. Sakit.
Pero maganda siya. Parang na-exercise.
Ganito lang ata gagawin. Finger extension.
example position. Ayun, ganun o. Extension na kaganon yung. Ganon, hip abduction.
Hip hop.
Abduction. Abduction.
Abduction. Adaption. Adaption.
Reflection. Extension. At extension. Dorsey. Dorsey. Tapos flexion. Basta pag flexion, nakapol.
Okay. So your classmates,
Ano yung dulo?
Kailangan nakapit tayo, no?
Plantar. Plantar. Tapos ano yung ganun? Dorsal. Ano yung elbow extension? Ganyan lang. Hindi, elbow. Elbow flex.
O ganyan.
Flexion.
one mistake of one member, everybody. Group 1, 2, 3, and 4, let's see who will perfect. Or get perfect, okay?
Kailangan
So, one mistake of one member, no points.
Okay, kailangan isulat siya.
Mag-negative na ba?
Ha?
Mag-negative.
Oh, negative. Okay, one more, okay? NTC and A.
Teka lang.
Hanapin mo yung Newton 5G.
Ano yung next?
Extension. Lateral. Flexion. Okay, shoulder. Flexion. What's that? Rotation.
Internal.
Okay, and internal rotation. This is abduction. This is abduction. Elbow flexion. Extension. Pronation. This is supine, ha? Supine prone. Flexion. Finger extension. You flex, then extend.
Basta lahat ng extend pag open.
Hip flexion. Or like this, hip flexion and extension. Abduction. Okay. Adduction.
Abduction si ano lang stop. Ano lang.
Rotation. Internal rotation.
Saan mo nakita?
Okay. Here. H-R-O-M. Your classmate will say right or wrong. Okay?
Okay.
Let's
Paano nga kung hindi kami magkapamiho ng answer?
wrong. Okay. This is, okay, let's say, it's not yet final. Okay, let's go.
Practice.
Okay, yes, 4 of you. Okay, let's go try. 4 of you.
Pag yung motion. Hanapin na
What group you are?
Hoy, bakit kayo lang dyan?
Pwede ba i-play? Shit.
Makita ba?
Kailangan sarado yung... Sarado at tumatatay, giatay.
Di bala na?
Ano yung unang date? Video mo pa.
Nasa YT, live. Live ka, makita ka ni Ma'am Elsie. Ay, ni Ma'am Mami. It's Ma'am Elsie. Ma'am.
I see.
Tatanggalan pala tayo ng ano.
Abduction. Garrett.
Saan mo galing yan, Len?
Lagay na.
Kailangan natin yung ma-memorize.
Mabasa na lang mga. Pareho lang yung shoulder extension sa abduction.
Mag-practice tayo dyan sa likod.
Abduction is away. This is the center of your body. Away.
Away.
Abduction is towards. Towards the body here.
Yung abduction, so gagano ka abduction. Extension.
So, flexion.
Abduction, if you're doing it, this is
Abduction.
Abduction.
Extension po.
Okay.
Shoulder extension, no? Extension. Ano lang, parang ganyan. Ay, elbow pala to. Elbow extension.
That's flexion, extension.
Ito flexion.
Flexion, extension.
And ito
Okay.
elbow flexion, extension. Ito yung abduction, adduction.
May tagasulat ng points, ha?
Ganyan yung
Extension. Kayo ang nag-ano?
Flexion, extension.
Kung ilan ang nakuha nila.
Ano yung abdomen? Radiation.
Oh, ito.
Radial.
Parang ganyan lang eh.
Ano to? Ano to?
Radial lang alam ko.
Hindi ko alam. Alam ko rin.
Asan ba yung video?
Siguro radial na tayo.
Go mga pair.
Ano ba yung
Una dahil ulo. Ayun, yun.
ulnar division? Tapos tuhod pa. Ganun
Patuhod na.
Ulnar. Ulit.
Okay na.
Ang dali-dali naman, ma'am. Alas 2 ang tayo matapos.
Isa na lang, ma'am.
Okay.
Talaga ako.
Shoulder flexion.
Tignan mo ako, tuturo ko. Hindi niya makikita.
Ito yung
Sandali na.
External, internal.
Iyan pa na.
Ulit mo daw, Lin, from the start, Len.
Deflection.
Ano daw?
Okay. Leg extension.
Extension.
Lateral flexion. Lateral.
Teka muna.
Lateral flexion.
ano yung sabi mo sa lateral? Lateral lang yung flexion yung gumagano.
Ano ba yan? Sige.
Shoulder flexion.
Okay. Next flexion. Next flexion. Flexion.
Ano yun? Flexion nga. Kaya,
Extension. Extension.
extension. Okay. Extension. Ganito. Boy, ganito.
Shoulder flexion.
Shoulder flexion. Teka muna.
Anda. Bagsak na.
Teka muna. Nagkikinig ako.
Pronation, supination. Extension.
Ay, makainig ka dyan.
Ayusin mo.
Ito yung gano'n.
Sabi mo
mo, neck. Oh, reflection. Extension. Okay?
Session lang mo para ano.
Sige na. Bebe, okay na? Wala. Teka muna, ma'am.
Ito naman, para hindi naman dito.
Practice mo na sa isa.
Kunin natin lahat.
Adduction. Nakasta, neck lang siya. Neck. External. Internal.
Flexion mo na tawag dito. Flexion mo
Body
na.
positioning?
Magbibidyo.
Range of motion.
Ha? So, motion?
Naka-forward naman.
Doors.
Neck flexion, neck. Okay? Neck extension. Okay, lateral flexion. Lateral.
Move the body, left and right.
Lateral.
Left and right.
Dalawa ka na. Okay. Like this. Like this. Shoulder flexion. Shoulder. Okay. Shoulder rotation.
Rotation?
Rotation. Internal rotation. Internal rotation. Internal abduction.
Trial mo ba ito?
Abduction.
Ano ba?
Mamay. Kasi wala kayong
Abduction ba para nyo?
yung neck namin, mama, saka yung ano.
Ganito ako sa ano. Internal dito sa likod.
Tapos,
Nandun ang importante. Sige. The next group. Group 2.
May hip extension sa likod.
thumb.
Okay.
They didn't reach that part. Hip flexion. Paano yung knee? Paano yung knee? Yung knee.
Ganyan. Parang tinupi mo yung tuhod mo. Ganyan lang, parang maarte. Oo.
Okay, this is the finger. Finger extension.
Extension sa finger.
Thumb opposition.
Thumb. Hip.
Flexion. Isa pala. Isa yung, ayan, nakaganyan siya.
Over your eyes.
Hip extension.
Extension sa likod.
Tapos,
Okay.
hip
Next
abduction.
flexion.
Marunong.
Ito.
Okay. Next is shoulder flexion.
Ito pa. Ito din.
External rotation.
External. Shoulder flexion.
External. Okay, abduction. Very good. Okay, abduction. Very good. Okay, pronation. Let's say pronation. The hand. Pronation. Very good. Pronation. Yes, so pronation. Okay, good. Okay, rotation.
Tapos na?
Ay, tapos na sila. Hanggang doon lang sila.
Sino pa? Tayo na! Kamatay. Guniti ra good Ben.
Ayun na pala eh.
Dito ka Ben.
Hindi man ako nakadali.
You know, it's a part of the mind, right?
Upper lang, babe. Magpunta ako tayo, mag-uniform lang. Upper lang. Upper lang, babe. Upper lang. Uy, atay na. Ano we have to? May uniform siya. Hindi, kailit ko nga. Kailit. Oh, you were. Okay. Ang taas lang naman, di ba? Oo, taas lang. Leg mo na. Okay.
Kaya mo po, take video. Sorry po, now take video. Nobody.
Ma'am, sa gitna naman yun sa kanila, ma'am. 1 minute school nila. Sorry na. Oy, close your eyes. Open your nose.
Hi guys! Tulog na kami guys. Dito kayo takpan mo ko lang. Mali ako yun.
Okay. Cover your eyes. Okay. Start. Neck flexion. Okay. Neck extension. Okay. Lateral flexion. Okay. Shoulder flexion.
Ala, patay na. Ala, ano yun? Ano na?
External rotation.
Ala, mali na yata ako. Asa na ba yun? Ay, external?
Rotation. Abduction. Abduction.
Abduction?
Abduction, okay? Abduction. Okay, very good. Sino? You will judge who, ilan sila? Nakuha?
4.
Ala, mali na ako.
4? Okay. So later again.
Mali na ako. Yata na din mo.
4.
Saan na yun? Di ko alam.
Nakuha ko ba lahat?
Yung abduction. Di ba naka-abduction?
Abduction.
Nakagano'n.
Hindi ko memorize. Hindi ko ma-memorize, oy.
Abduction.
Abduction, ano di ba?
Abduction. Abduction.
Hindi ko memorize, wal.
Yeah.
Mali-mali eh. Mali-mali na, bahala na. Hindi ko ma-memorize. Atay eh. Hindi ko memorize, atay.
Guys, ano yan?
Uulit ba tayo, Len?
Ano yan? Saan tayo nag...
Nasa YT.
Nalito ka sa... Hindi ko kasi natin...
Patingin daw ulit, Len.
Sister, come here.
Ilalagay sa YouTube.
Let's review.
Titingin daw, Len. Dito daw ako, Be.
Abduction and adduction, right?
Lito-lito na eh.
Do again? No, we will do
Dito
the
nga ako
second
titingin.
half.
Mali-mali na. Panood nga ulit dito.
Elbow flexion.
Okay, start.
Meron ba yan sa YT, Len? Sa YT ni Ma'am yan, Len.
Supination. In the YouTube, it's supination. Just remember the bed position.
Neck
Supine.
flexion. Okay. Neck extension.
Lateral
Okay.
flexion.
Lateral flexion. Lateral flexion. Okay. Shoulder flexion.
Shoulder.
Okay, very good.
Mali.
Okay, external rotation.
External.
Rotation. Okay.
Ma'am Elsie.
Perfect na ni Andrin. Perfect na yan. Go, go.
Ang dami kong mali. Hindi ko alam. Hindi ko memorize. Sabi ko na saan na ba ako nito yata.
Yeah, you do.
Panood na ulit.
siya nagtalo sa Sino talo, ma'am? Nagtanong ka ng pangalan sa YouTube, hindi na talo. Wala na.
Meron naman doon eh.
Okay, cover your eyes. Okay, go.
Wala sana yung mask mo. Wala na.
Okay.
Ma'am.
Ito. Sana yan ka, dali. Advance pala kayo sa Monday.
Ano ba? Dapat ito magbuha ka. Alis ka nga dyan.
Hinahinga ka mo.
Makahinga naman ako. Hindi ako
Okay.
sige.
Sige. Neck flexion. Neck extension.
Okay, very good.
Lateral flexion.
Ishway natin.
Okay. Shoulder flexion. Okay. External rotation. External rotation. External rotation. Abduction.
Abduction ba?
Abduction. Okay, ilan nakuha?
1.
Ilan nakuha nila? Apat?
Bakit ang maliit sa nakuha?
Okay.
Dalawa. One lang next. Isa lang?
Okay, very good.
Parang puro ka mali doon eh.
Okay. So all of you,
Sister, check.
Sister, perfect na.
okay, all of you, bahan. Okay, so do this, all of you. Okay,
Mainam na exercise.
okay. Stand, everybody. Okay, once in a while we have to play. Okay. Neck flexion. Okay, neck extension. Lateral flexion. Shoulder flexion. External rotation. Okay. Internal rotation. Abduction. Adduction.
Dalawang abduction?
Abduction. Oh. This is elbow flexion. Elbow rotation, extension, I mean. That is supination. Pronation. Next is ulnar deflection first. Then finger extension.
Wrist pala to.
Wrist. Next, finger flexion. Then finger extension. Okay. The next is thumb opposition. Okay. Next, hip flexion. Okay. Hip extension.
In the back.
Okay. Next is hip adduction. Okay. Hip abduction. Okay. Internal rotation.
Like this. Nakapicture.
External rotation.
Like this.
Knee flexion. Knee extension. Okay.
Front.
So that's the end.
Yung ganun po, yung titingkayan tapos yung gano'n. Yung
Dorsal
dorsal, plantar, dorsal,
Okay.
dorsal, and
And we
plantar.
have plantar flexion. Okay. So this. Sit down. Okay, later after the class you will do this. Okay.
Nangyari dyan. Ay! Meron ka na. Ay, meron ka diba?
Ito ba?
Yes, ito yung balita. Hindi, ito yung caretaker yung isa. Meron ka naman for the description na ito yung may nasign na tayo. Saan ba yung motion dito? Sa likod ka.
Okay.
Yes! I want this one.
Daily care plan ay katapos na, no?
Hindi pa po.
Sa CG mo.
Sa CG lang po.
Oh, this one. Ay, bakit may itong sa'yo?
Hindi mali ka kasi nung yung taas dapat yung nasa-signan mo, tapos nababa ko sa daily care plan yung nasa-signan.
Sa daily care plan.
Wala yung pangalan ko pala dito. Kailangan ko lagyan ng pangalan.
Okay, we will do daily care plan.
Daily care is
Oh, guys, I will show you a movie. It's not a movie. It's a video clip.
ulitin na lang yung pala.
Tapos ka na
Dito na ako. Personal bakit last time pumasok sila kung meron?
Dati ang this group only to maybe 10 students. Now, abang dami na.
Yung sa ano yan? Prepare mo.
Meron ko palang ganito. Plastic sa ano eh.
Friday, hindi na ako madalas. NGT na sa Melbourne Friday. Ay, hindi Friday ka ba lang ako.
Okay, again, you group yourself. The same group. Okay, for daily care plan.
Daily care na.
Ay, ito na kita daily care plan.
Nandyan yun sa iyo, di ba? Saan yung daily care mo nakaraan?
Yeah, you have
Sa CG kasi.
Meron ka?
no practice.
Gawin natin ang dito.
Parang dala ko yun.
Saan ba daily care? Ito kayo. Anong topic yun ang daily care plan? Wala, magdidinis na yung pa.
Ang sa hindi. No, mabig yun.
Ito.
Same.
Ano siya? Sa picture.
Okay.
Okay? Ah! Give money.
Four.
Four naman.
Four na kayo. Four?
Anong force?
Model care.
Saan ang
Kaya
force?
ano, hindi ko kunin mag-review sa lang sa lab. Magreto siya sa lab. Anong oras na?
Ako? Sa blooming? Oo, pink ka. Ha? Blooming ka. Nag-blooming ako.
Nawala lang nag-blooming.
Nawala lang ako, nag-blooming na ako. Ganun ba yun? Blooming daw ako, guys. Nawala lang ako ng blooming kasi siguro na-miss mo lang ako, okay? Sa hospital pala kagabi to, ma'am.
Oh.
Sila ko yung reaction. Ano nangyari? Tumawag sila. Para na kayo kasi ano, si Wonder Woman. Lahat ginagawa.
Sino?
Ginawa ko na.
Si Kay. Nag-Wonder Woman.
How to find an IV gun?
Ito yung dapat ito.
Baka mamaya makalimutan ko yung wallet ko. No?
Patay pa naman. Diba? Pa lang.
Baka dito.
Mas mabilis dito. Kasi siya. Ikaw mo.
Disorder like diabetes, okay, stroke, all of these videos, okay, then Jiba, tapos na kayo nito?
Opo, ma'am. Siya lang.
Pero Friday lecture yun, ma'am.
Ah, that is,
Okay lang, ma'am.
that's why I'm asking.
Model 4?
Yeah, this is only more.
Ito yung... Kasi yung diabetic.
Master.
Ginaster na ni ate ko. Diyos hindi tayo. Pero ito mo.
Dementia muna, ma'am.
Dementia will go. Iyak na naman.
Kanino nung na ate. Doctorate na mo.
One versus type 2 diabetes, which I call diet treatments. Since this blood is turned to mud from that thick sugar, and over time this high sugar destroys the vital organs and blood vessels, leading to kidney failure, nerve damage, blindness, and even high blood pressure. Now to clarify, DM is for diabetes mellitus, not for direct message. So guys, it doesn't go down in the DM. And it's not the same as diabetes insipidus. Guys, DI is a diuresing peeing problem, not a sugar problem. Now for pathobasics. As you know, blood sugar naturally increases when we eat. The pancreas releases insulin from the beta cells, and also enzymes to help break down food for fuel. So remember, insulin puts sugar and potassium into the cell, making our hungry cells really happy. Now when we give insulin, both sugar and potassium decrease in the blood, since it's going into the cell. Now, if we don't have food, then the pancreas has a backup plan. It releases glucagon hormone to break down stored glucose, aka glycogen, in the liver, which increases sugar in the blood. Glycogen is kind of like a glucose brick wall. So remember, glucagon means glucose gone out of the liver into the bloodstream, which increases blood sugar. So again, when blood sugar is high, like after you eat, insulin is released. And when blood sugar is low, like when you exercise or forget to eat, glucagon is released. So in diabetes, insulin is the problem here, guys. Type 1, we have none. Since the body has killed its own pancreas, it produces no insulin. And people are born with it. It's an autoimmune disease. So type 1, you can pass on to your son, since it's genetical. And these patients are insulin dependent for life. Big key word. Now in type 2, remember, few insulin receptors work, since the problem is you, your diet and lifestyle. The high in sugars and sitting sedentary lifestyle. We're out. And now just ignore the insulin. This is called insulin resistance. So just think, in type 2, the cells are through. They quit responding. Now the risk factors for developing diabetes. Guys, in type 1, there are none, since it's mostly genetical. You can pass it on to your son. And in type 2, the problem is you, your diet, and a little bit of genetics. So we screen for metabolic syndrome, which increases the risk of not only diabetes, but also heart disease and stroke. Now this is big on exams in the Nclex. So we use the acronym BOL for metabolic. Our next B is for blood sugar medications or high blood sugar over, key word here guys, write this down, 100 fasting, over 100 fasting. O is for obesity, big key words here guys, waist size over 35 for females and over 45 for males. And lastly, L is for lipids that are high. This is not good. We're talking high cholesterol panel. Write these numbers down. 200, 150, and 100. All should be low except the HDLs, our happy lipids. That one should be over 40. Now guys, if these numbers are off, it could mean metabolic syndrome. And this contributes to insulin resistance in type 2, where the cells are through. Again, like an overused lock. The cells stop responding from the overuse of insulin. Now I can already see questions coming up on your exam and Nclex. So I recommend writing this bold memory trick out at least 15 times the week of your exam. Now to help you, here's a common practice question. Which clients are most at risk for developing metabolic syndrome? A 35-year-old male with triglycerides of 140. Nope, guys, the triglycerides are under 150, so that's okay. How about option number 2? 48-year-old female with a fasting blood glucose of 105. Guys, yes, fasting sugars over 100, metabolic syndrome. Option 3, 55-year-old female with a waist size of 40 inches. Oh yes, over 35 waist. And a 28-year-old male with a blood pressure of 135 over 85. Guys, yes, the systolic pressure is over 30. Lastly, a 42-year-old female with high HDLs of 55. Guys, no, those are the only lipids that should be high. Over 140. Just think the high lipids for HDL. Now, speaking of type 2, technically not a cause, but a very particular sign of insulin resistance. Keyword, write this down. Brownish or dark thickening on the neck and armpits, or even hyperpigmentation and skin tags. This is what's called acanthosis nigricans. Now, as far as diagnosing diabetes, the top 3 must-know labs for the Nclex that you will get tested on, guys. Write these down. Number 1, normal glucose must be 70 to 115. Number 2, fasting glucose less than 100. And third, hemoglobin A1C must be less than 6.5. Those are big Nclex key numbers there. Write those down. Now, as you know, the A1C test is our long 2 to 3 month sugar audit, and is best used to see if patients are being compliant with controlling their blood sugars the long term. So remember, below 6 is controlled and fixed, and over 6.5, we gotta revise. So review diet and exercise compliance for our type 2 problem, basically the U problem. And with type 1, insulin compliance, always on the Nclex. Now the most deadly is low sugar, under 70, called hypoglycemia, since it causes brain death. So we say hypogly, the brain will die. Now all the other numbers on this chart just help diagnose the severity of diabetes, but are not highly tested on the Nclex. And speaking of something that's not highly tested, a little side note here. The GTT, or glucose tolerance test, is when we give an 8-ounce drink of syrupy glucose to see if insulin is doing its job by putting the sugar into the cell. If it's not, then the sugar will go high. But guys, that's not usually tested on the Nclex directly. Now, signs and symptoms and causes of high sugar, or hyperglycemia. Just think, the blood is turned to mud. So the body tries to get rid of all this thick syrup with the 3 Ps. First P for polyurea, a lot of urine. Basically, the body tries to urinate it out. Now, polydipsia is a lot of drinking fluid. The body tries to dilute all that sugar. Now, third is polyphasia, which is excess hunger as cells starve. Since insulin's not doing its job to get sugar inside the cells. Now, a little side note, this is not polyphasia, which is a psych disorder. Now, the causes of acute high sugar can be caused from the 4 S's. The number 1 key term on the Nclex is sepsis, or infection, guys. That's a number 1 cause. But also stress from surgery or hospital stay, and even skipping insulin doses. And a big one here is steroids, those zone-ending drugs, like prednisone. That is a big cause. But high sugar can also be caused by the insulin during stress, like sepsis, surgery, and especially with steroids. And guys, know the patient's not on insulin forever. Once the S's stop, then the insulin stops. And guys, the big key word here, if the sugar is still high after the insulin, that's a critical situation. Always call the doctor or HCP. Now on the other side, for hypoglycemia, that low sugar, below 70, guys, just think low brain function, which leads to rapid brain death. So remember, hypogly, the brain will die. We're going to be watching for critical signs. The cool, pale, sweaty, or clammy, we need to give that patient some sugary candy. Now, typical Nclex keywords include high wash. So headache, irritability, weakness or anxiety, and even shakiness and hunger. It's kind of like a Snickers commercial. You're just not you when you're hungry. Now, since hypo is so deadly that hypogly, the brain will die, our very first treatment is giving sugar. So on the Nclex, if the patient is awake, then we ask them to eat. Specifically juice, soda, crackers, and low-fat milk. Not high milk or peanut butter. Big key word right there. The fat actually slows down the sugar absorption. And if they're asleep, big key word here is not alert or unarousable or only arousable to painful stimuli. Then we stab them with dextrose IV. And always reassess sugars every 15 minutes after giving insulin. Now, causes of hypoglycemia. They usually come from exercise, alcohol, and even insulin peak times. Big Nclex tip right there. So watch out for diabetic athletes who exercise. If your patients exercise, then give extra glucose. Keywords, bicyclists, swimmers, and even runners. Now, alcohol is also a big no-no, technically with any disease, but it actually lowers sugar, doesn't increase it. And insulin peak times is when patients are most at risk for that low sugar. So remember, if there's a peak time, then we give a plate of food. Since hypogly, the brain will die. Now, 3 common test questions for that low or high sugar. Here we go. Test question number 1. A client with type 1 diabetes is only responsive to painful stimuli. With a blood sugar of 42, what's the first action taken by the nurse? Guys, this is the worst case scenario here. Anything less than 70 is bad. So hypogly, the brain will die. Now, patient is not alert, only responsive to painful stimuli. So if they're not awake, we can't ask them to eat. Technically, the patient's asleep, so we stab them with dextrose IV, and then we reassess blood sugar in 15 minutes. Oh, and if it shows option 4, shaking my head at you. Question number 2, which medication could cause hyperglycemia? Now guys, before you look at the options, you should already be saying steroids increase the sugar, ending in zone, like prednisone. So guys, don't ending steroids. Steroids increase the sugar. Now the tricky question number 3. The non-diabetic client is admitted for a kidney infection that has now turned septic. 25. What is the best answer to give a family member who's asking why insulin is used? So option number 1, the client now has type 2 diabetes. No, that's a wrong answer. Option 2, insulin is given to control hypoglycemia. Totally wrong. It's for hyperglycemia. Option 3, high sugar is common during infection and stress to the body. And insulin will help lower the sugar until the infection resolves. Yes, option 3 is the best option. Super high sugars, we want to land like a plane, slow and steady. We don't want to crash into that hypoglycemia, that low sugar with low brain function. Now, if you chose option number 4, you nasty. Now, we get many complications from this long-term high sugar, where the blood is turned to mud. It's like dumping thick syrup into your blood vessels. And guys, imagine years and years of this. This destroys and scars the blood vessels called atherosclerosis, or atherosclerosis, and leads to more infections since bacteria love sugar. Ultimately, it destroys all the organs. So the kidneys are washing machines that wash the blood. Guys, these guys die, which is called nephropathy or renal failure, indicated by creatinine over 1.3. So remember, Nclex keyword, creatinine over 1.3 means injured kidney, and also means no more PP. So patients either get a transplant or go on dialysis to wash the blood. And nerves die, called neuropathy, so patients get loss of sensation. And they don't even realize when they get small cuts and injuries on their hands and feet. Not to mention the sugary blood. So we call diabetic feet delicious treats for bacteria. This leads to infections and slow wound killing. And then to amputation and cutting off of those dead feet from all the infections. Now in the eyes, the small blood vessels break, called retinopathy, which leads to blindness. So Nclex key term here, guys. frequent eye exams are recommended. And in the heart, we get hypertension from all that high tension on the heart, eventually leading to heart disease and then ultimately heart attacks. Lastly, in the brain, we can have CVAs or strokes from all those narrow blood vessels that either burst from aneurysms or get clots. Now, as far as diabetic treatments, guys, we're going to cover all the diabetic pharmacology, including the 7 rules of insulin. So write these down. These are the most tested. So remember, type 1, we have none or no insulin. The body destroyed the pancreas, so they are insulin dependent for life. And type 2, the problem is you, your diet, and a little bit of genetics. So remember, type 2, we have few insulin receptors working. So the first treatment is to fix you, your habits. So we focus on diet and exercise to help repair those broken receptors, aka increase insulin sensitivity. Then we give drugs like oral meds and insulin, but only if diet and exercise don't manage it alone. So for our 7 insulin rules, peaks equals plates, guys. Typically we give food during a peak, since the greatest risk for low sugar is during those insulin peaks. Guys, the #1 way to kill your patient is not giving food during the peaks. So know your peak times. During peaks, we monitor for that low sugar below 70. Now, #2, if you get low sugar below 70, or if your patient looks shaky or trembly, the classic signs, pale, cool, sweaty, or even clammy, give that patient some sugary candy. The priority key terms, again, are the A's and the S's. If your patient is awake, ask them to eat. Always sugary food here, guys. So soda, juices, crackers, and low-fat milk. Not high-fat milk or peanut butter. Guys, fat will slow the sugar absorption here. And if they're sleeping, then we stab them with IVD50. Sleeping means unresponsive or unarousable. Responsive only to painful stimuli. So don't just go stabbing sleeping diabetics here, guys. Always assess the sugar and symptoms first. And after you give sugar, always reassess 15 minutes later. We always follow up after any intervention, always checking the sugar and the symptoms. Now the 3rd rule, insulin with no peaks and no mixes. It's our long-acting dudes. Guys, the memory trick is the old dudes, like grumpy old men who have been here for a long time, they're past their peak, and they never mix well with others. They're basically antisocial. So the key words, draw up in 2 separate syringes. So remember, Detromere lasts all year. And glargine is large lasting. And Lantus is like a lantern. It burns all night. Now #4 here, guys, a big Nclex favorite. They're gonna try and trick you. So the IV only insulin is regular insulin. So remember a memory trick here. Regular insulin is ready to go IV, or regular is right in the vein. Not NPH, not Lispro, not Lantus. Guys, no one except regular. He's the VIP for the IV. Now, #5, we draw up insulin. Always clear to cloudy. Guys, just think you want clear days before you want cloudy ones. So draw up regular insulin first, the clear, and then NPH, the cloudy second. 6, we rotate locations every 2 or 3 weeks. And the best location is always on the abdomen. Keywords here, near the umbilicus, navel, or belly button. And guys, we never aspirate. Basically, never draw back on that plunger. It'll cause scar tissue and swelling. And also, we never massage or add heat after sub-Q injections. Now lastly, #7, DKA, the extreme high sugar condition in type 1 diabetes, guys. We have a separate video for that, but here's the big Nclex question here. Do we give insulin on sick days? What if the patient's not eating or basically too nauseous to eat? Well, yes, we give insulin without food. We just monitor that glucose closely. So remember, we always increase the insulin during the S's, like stress, like surgery, sepsis or infection, and even sickness and steroids. Now, we're not using big Nclex keyword again. Draw up in separate syringes, never mix. These guys have no peaks, so they require no plates, or basically they're not food dependent. And now NPH are cloudy, dude, always being mixed. So remember the N's. Intermediate insulin, and we never give it IV drip or bag. Guys, never put anything cloudy in an IV bag. Now, when we do mix it, always mix clear to cloudy. Clear days before cloudy. So we usually give NPH 2 times per day, not 4 times a day. so don't let the Nclex trick you. Now the peak time is between 4 and 12 hours, but most dangerous in the middle, around 5 to 6 hours. So make sure you have a plate of food with that peak. Next is regular insulin that's ready to go IV. Guys, again, he's the only dude allowed IV push or IV bag. If you haven't wrote that down, please write it down. His peak is between 2 and 4 hours, so monitor closely for signs of low sugar. That shaky, pale, cool, and clammy, we need to give some sugary candy. Now finally, our most deadly insulins. They're the #1 priority since they have the #1 fastest peak and onset. 15-minute onset, guys, with a 30 to 90-minute peak. So rapid-acting insulin, remember, Lispro, Aspart, and Glucosidase. So memory tricks here. For Aspart, you gotta remember to move your ass parts, guys. It's really fast. And Lispro, just think Lespro. Less time for the onset. It's 15 minutes. And Glucosidase, it goes fast like a limousine. It's super fast. So we give these during meals. Keyword here, patient is eating or there's food at the bedside. Again, guys, patient must be eating in 10 to 15 minutes, not before the food's delivered. Usually an Nclex question. Those peak times are the must-knows for the Nclex. So I'd recommend printing this study guide out and reviewing it every day the week of your exam. Now, a little insulin quiz. We're covering the top 3 most tested Nclex questions on peak times. Here we go. Again, peaks are priorities. The fastest way to kill your patient is not giving a plate of food with the peaks. So remember, peaks require plates. So we drew a little plate on the flag showing the peak time. Now, our red rapid guys are the most deadly. Always monitor for hypoglycemia, that low sugar below 70. You're gonna see shaky, sweaty, pale, and clammy, so we give that patient some sweet juice, soda, or candy. Okay, question number 1. The nurse gives regular insulin at 12 p.m. for lunch, but the patient doesn't finish their food. So when's the greatest risk for that hypoglycemia? Guys, the risk for regular, look at the peaks right here, 2 to 4 hours. So if given at 12, the answer is between 2 p.m. and 4 p.m. Never before and not after. So guys, memorize these peak times. Now question number 2. A client is on Aspart insulin. When should the nurse advise him to eat? Again, guys, this is an onset of 15 minutes with a peak time between 30 to 90 minutes. So Aspart, get your Asparts moving. The best answer is the soonest, so eating within 10 or 15 minutes. Now question number 3, the client on glargine is asking the nurse when is the best time to eat during this insulin? Well, guys, glargine is large lasting, long acting, no peaks. So no peaks require no plates. Pretty tricky one there. Now for a little bonus question. We saw this a few times in our Nclex review. So the client taking insulin NPH with dinner at 7 p.m. What time is the client most at risk for that hypo low sugar? So NPH has a 4 to 12 hour peak. The most at risk, guys, we're looking at the green peak here. 5.5 to 6 hours has the most peak. So the best answer here is midnight or shortly after. Now before we move on to the insulin infusion pump, guys, the best way to memorize these insulin peak times is to print off the study guide or cheat sheet we provide, and guys, write this out at least 7 to 15 times the week of your exam. Now for insulin pumps, or CSII, the continuous subcutaneous insulin infusion. Guys, the #1 benefit is the steady dose of insulin for our type 1 kids who forget to take their insulin and are basically non-compliant. The biggest benefit and the coolest part here is we have fewer swings in blood sugar level. So not high or not low anymore, guys. It's a nice even basal rate. That's a big key word. Even basal rate. Now, how do you manage it? Well, we usually check the blood sugar 4 times per day, and you push, keyword there, push an insulin bolus button at meal times to get that sugar into the cell. Now, what if you get an Nclex question about a machine malfunctioning, guys? What do? Do you assess the patient or do you assess the machine first? Well, we always assess the patient first and then machine second. Now, that's really big on the Nclex. Now for oral agents, these are only for type 2, since the body responds to few insulin. Guys, the pancreas isn't dead here, it's just overworked. So oral agents help to decrease blood glucose and make the body more sensitive to insulin, kind of like repairing a broken lock. So we only use these after exercise and diet fail to manage type 2 diabetes. Big keywords there. After diet and exercise have failed. Now, in general, we never take oral meds with iron, calcium, and even antacids that contain calcium. These guys block absorption in the stomach. So guys, be careful. They're always in over-the-counter pills and medications. Nclex keyword here, OTC, or over-the-counter. Now for our 4 oral anti-diabetic drugs, guys, write these down. Metformin, or brand name Glucosidase, glipizide, Pioglitazone, brand name Actos, and Carbs. Again, guys, Nclex will not have brand names, only generic. But just in case, your nursing exams might still have those brand names. Now, the 2 biggest things to write down. We avoid alcohol and liver disease patients, since these drugs can be toxic to the liver. Now, first on the list is Metformin, from the class of biguanides. So guys, think big guys, like you Metformin in Metformin. They reduce the output of glucose by the liver and also increase insulin sensitivity. Now, that's not usually on the Nclex, but the M's of Metformin are. So remember this, minimal chance of hypoglycemia, that low sugar. Second M is for massive weight gain, not weight loss. And lastly, major liver and kidney toxic. So guys, no cirrhosis or hepatitis patients. Now the Nclex will try and trick you here, always asking which statement by the patient requires more teaching. So guys, it's never weight loss. Just think Metformin are 4 big dudes, so massive weight gain. And lastly, we always hold 48 hours before cath lab, since contrast kills the kidneys and leads to lactic acidosis. So guys, hold Metformin with cath lab. And a little side note about the kidneys. Creatinine over 1.3 usually means an injured kidney. And urine output 30 mLs per hour or less usually means the kidneys are in distress. Next is Sulfonylurea class. These guys stimulate the pancreas to release insulin. And they end in I, like glipizide or glyburide. And they're very bad for the heart. So think I, the heart may die. Guys, it's very bad for heart failure and MI history. Big keywords there. Now caution, guys, the Nclex and your exams are going to try and trick you with a suffix. Guys, other I-ending drugs like furosemide, a diuretic, the body is dry. Or isosurbride is a vasodilator. So our memory trick is the G's are for glucose, so glipizide and glyburide. And the F's, like furosemide, are for fluids that are dry. And the O's for isosurbride are the O's for vasodilator. Now, just like metformin, they also have a mini chance of low sugar, or hypoglycemic events. And they also cause massive weight gain. So again, guys, clients will not lose weight, they're actually going to gain it. And lastly, they also may cause sunburn, so we use sunscreen and protective clothing. Oh, and they're also toxic for our elderly patients. So metformin is always our first choice. Next is Pioglitazone Hydrochloride, which reduces insulin resistance, ending in "-one like thiazolidine dione. So think the "-one" or the 1 has 1 dead heart. It's very heart and liver toxic and a huge risk for heart failure. So again, heart failure means heavy fluid retention. Keywords here, new pitting edema, worsening crackles in the lungs, and rapid weight gain, which usually means water gain. Now last and definitely least, since this guy's not really common on the Nclex, alpha glucosidase inhibitors, ending in "-ose like carbos and precose. Guys, they rhyme with gross, since they cause massive flatus or farts and diarrhea. These guys are carb blockers. They break down carbs and decrease glucose. Basically digest food for you. But not given to IBS, irritable bowel syndrome patients. Now, as far as patient education for diabetes, we use the 2 Ds. D for diet that's low in sugar and low in simple carbs. And D for diabetic feet, which we call delicious treats for bacteria. So the top Nclex tips for diet. Keyword here is the lows. Low calories and low simple sugars. We avoid simple sugars with no fiber, guys. So soda, candy, white bread, white rice, and even juices. The goal is we want well-balanced meals with enough protein and fat. High fiber carbs, guys, these are good. So good carbs are the high fiber complex carbs. Typically keywords are brown or whole. So brown beans, brown rice, brown bread, guys, not white bread and not white rice. Bring it down to brown town. Now the next keyword, whole. So the whole grains, the whole wheat, and even whole milk. All these include high fat, and even peanut butter has high fat. This helps slow the sugar absorption. Now these are called our low glycemic index foods. So just think fiber slows the digestion of sugar. But caution here, guys, the number one offender are fruit juices, which are usually very sugary, since they took out the full glycemic or simple carbs. And you already know these carbs, it's the ones we love to eat. Typically anything white or sweet. So white bread, white rice, white pastas, even French fries, and deep fried anything, guys. Even low-fat milk. And also here, the keyword, fruit juices. And you already know the typical junk food. Candies, sodas, chips, and donuts. You know, all the normal nursing student stuff.
Oh, come on, man! This is all I can afford after my tuition. I mean, I could be helping the treatment, you never know.
So we teach clients to avoid these bad carbs during normal everyday life. But guys, during low sugar crisis, like the sugar's less than 70, that's when it's okay. Now for your third test tip, what if you get a blood sugar of 60 or less in the AM? Guys, we always tell patients to eat a bedtime snack. And guys, the fourth thing is therapeutic communication. Guys, these are always the weirdest questions on the Nclex. So they'll give you a totally awkward situation, then they'll ask, how should you, the nurse, respond? And guys, to be honest, there's only two options here. Either we ask more questions like, how do you feel, or how does that make you feel? Or you just be supportive. Guys, never ask why. Never use words that judge, accuse, or put the patient down. So guys, use common sense. Don't be a jerk or an idiot. Don't be an idiot. Now we don't want patients to feel bad, so not victimized, not dependent, not helpless, or sacrificed. So guys, yes, be supportive and educate that patient. So yes.
This is more of interest. Now I will give you this form, each group. You will do your nursing plan of care according to the video that I will show.
I-distribute ba yan, ma'am?
Oo.
Okay na.
Those who want to know module 4,
Tapos ka na kayo?
group A. Okay, that is per group, okay? This group, during we have previously. One group more. This will be our last activity.
Group 5.
Kulang ka po, ma'am.
Kulang. Ay, kulang?
Kulang.
Kulang.
Marami pa yun.
How many? One, two, three. Three more? Marami kang wala. Sorry. Okay. You ask from Mr. Ramis.
Ma'am, yung po bang binigay yung first nung nag-enroll? Obvious po ba po dyan 5 minutes?
Binigyan ka?
Module 4.
Ay, ikaw? Module 4?
Module 2, sige, Friday. Sige, sige lang, no worries.
Yeah.
Okay.
Ma'am, according to sa anak.
By group. No, according to this video. Okay, this is by group. You watch the video, then you have to fill on that form.
Nursing plan natin. Ito. By team natin.
Okay, this is by group.
By group.
Okay, this is the video.
Tapos group na video.
Group 4.
This is Rock Kingstown Rescue 1. We're coming to you with a 43-year-old female conscious and lethargic, cold stroke. She has a LAM score of 5 and a GCS of 14.
She has left-sided facial droop. She has no movement of her left arm. She has no grip on the left side, and her eyes are gazing to the right.
Hi, Brooke. My name's Dr. Armando. I'm part of the neurology team. I'm going to do a quick exam, okay? Look all the way to your left. Hold your right arm in the air. Hold up for 10 seconds. Ready? 10, 9, 8, 7. Good. You can relax. How about the left side, Brooke? Hold it up for 10 seconds. Ready? 10, 9. Okay. Okay. Let's go to CAT scan.
What do we got, guys?
So this is Brooke O'Connell. She's a 43-year-old female. Looks like she has a right M1.
So we've got a tandem occlusion of the right middle cerebral artery and the right internal carotid artery in the neck. She's young, probably on the basis of a dissection. All right, let's go open it up, guys.
What do you want for meds? Blood pressure is 144 over 87.
Can you give to a Versed and please give Adazopran, and we're probably going to have to stent this internal carotid, so I have cannula ready.
Hi, I'm Brooke O'Connell. I'm from North Kingstown, Rhode Island. I'm 43. I'm a wife. I'm a mother of 2 active boys. I'm a pharmacist, and I was blindsided by a stroke. My journey began at February vacation. Michael and I, my husband, took the 2 kids to Universal Studios. I love roller coasters, as does my youngest son. And we were on a roller coaster that had a corkscrew. And in the middle, he's screaming, "Mom, put your hands up!" So I tried, and it kind of pushed me back a little bit with the centrifugal force. Didn't think anything of it. Got off the ride. Was a little sore, but didn't have a headache. Wasn't nauseous. Didn't feel bad in any way. Came home. Went back to work that week. Met the family for dinner afterwards. Walked into the restaurant. It was busy. Couldn't find them, so I tried to call. Called my husband. Dropped my phone, which was strange, but didn't really think anything of it at the time. Tried to pick it up, dropped it again. Thought it was very odd, but found them, walked back to where they were. My older son was waving his hands, trying to get my attention, never saw him.
Brooke joined us at the table and was definitely disoriented, garbling her words, and at that point, we knew something was wrong.
My sister-in-law, who's in the medical field, said, "Stop, sit down, call 911, and I was like, no, I knew there was something wrong, but I was not willing to kind of admit it, I guess. Called the rescue. I walked out of my own power. Within probably 45 seconds, I was talking normally.
At that point, we were questioning, do we still go to the hospital? We made the decision, was still going to go to the ER and have her fully checked out, so glad we did.
They did take me to the closest hospital and sent me for a CT, where they told me that I had a dissected carotid artery, and they sent me to Rhode Island at that point and had some more intense care, more neurology sort of tests and things. Sent me home about 36 hours later or so. Sat on the couch, and one of my friends came to visit, talked for a few minutes, and then started to garble my words and couldn't speak. At which point my friend said she knew what was going on, and the look on my face, I guess, was, I can't believe this is happening again. My husband called the rescue. The rescue was here within 10 minutes, very, very quickly. After finding out that I was just discharged from a stroke, they got me in the bus as quickly as they possibly could and had me to the ED at Rhode Island Hospital faster than I even know.
Brooke had a severe stroke. This stroke was on the basis of a tear of the artery in the neck, which then sent clot up into the brain. That's the reason her clinical exam was so severe. She was unable to move her left side, she had a drooping of the left side of her face, and she was ignoring the left side of the world, which is why she was gazing to the right and her head was turned to the right. Because of the technology that we can offer to open these blood vessels up, we can now send patients home fully functional, whereas just a few years ago, these patients would be dead or disabled.
If I didn't get to Rhode Island Hospital as quickly as I did, my outcome would be totally different. And I can't even imagine my 11 and 12-year-old sons being without a mom. I was at the right place at the right time. Thank goodness Dr. McTaggart was on that day. The second I was through those doors, I had everybody I needed, between the doctors and the neurologists and the PAs, all the technicians. It's just amazing. And I didn't have to go through jumping through hoops with protocol. And I didn't have to be diverted from one hospital to another. I still can't wrap my head around what happened. 6 months ago, I was healthy and normal, and now I've got this huge life event that's in my rear view. And if I can help further this mission of Dr. McTaggart and just the fantastic work they're doing for stroke care in Rhode Island, I'm happy to do it.
The reason we need to support the American Heart Association is it's the only organization that's dedicated to funding research so we can advance these fields, but it's also the largest organization dedicated to supporting legislation to get patients to the right place the first time in every state. And that's what we're doing here, and we want to see that happen in all chapters the American Heart Association covers and is affiliated with, and there's no organization in the country that is more capable of doing that.
Okay, so your form here, you write the name of the patient, and this is process. It was mentioned in the video together with the past history or the present history here, okay? Signs and symptoms of a patient when she arrived in the hospital. And the other one is what is really the potential and the real problem why the patient has body weakness. Okay, nursing intervention, what will you do? Okay, what will you do when there will be body weakness? Okay, you can also include the rehabilitation and this physiotherapy or this range of motion. Okay, you can place it here. And patient outcome. What will be the possible patient outcome? Let's say if you are doing physiotherapy, what will happen with this weak arm? Okay, so you have to write it here. Then at the back, write your members, the name of your members. This will, it will be in your, instead of daily care plan, you did already during your caregiving. So this is another activity and we call this nursing plan of care.
Nursing plan.
Okay?
Ma'am, yung nangyaring stroke sa kanya is ischemic, right? Correct, not hemorrhagic.
Okay, so you have to write, when you want to play, you want me to play again?
Yes, ma'am.
Hi, this is North Kingstown Rescue 1. We're coming to you with a 43-year-old female conscious and lethargic, code stroke. She has a LAM score of 5 and a GCS of 14.
She has left-sided facial droop. She has no movement of her left arm. She has no grip on the left side, and her eyes are gazing to the right.
Hi, Brooke. My name is Dr. Armando. I'm part of the neurology team. I'm going to do a quick exam, okay? Look all the way to your left. Hold your right arm in the air. Hold up for 10 seconds. Ready? 10, 9, 8, 7. Good. You can relax. How about the left side, Brooke? Hold it up for 10 seconds. Ready? 10, 9. Okay. Okay. Let's go to CAT scan.
What do we got, guys?
So this is Brooke O'Connell. She's a 43-year-old female. It looks like she has a right M1.
So we've got a tandem occlusion of the right middle cerebral artery and the right internal carotid artery in the neck. She's young, probably on the basis of a dissection. All right, let's go open it up, guys.
What do you want for meds? Blood pressure is 144 over 87.
Can you get to a Versed and please give Zopran, and we're probably going to have to stent this internal carotid, so I have Kango already.
Hi, I'm Brooke O'Connell. I'm from North Kingstown, Rhode Island. I'm 43. I'm a wife. I'm a mother of 2 active boys. I'm a pharmacist, and I was blindsided by a stroke. My journey began on February vacation. Michael and I, my husband, took the 2 kids to Universal Studios. I love roller coasters, as does my youngest son. Then we were on a roller coaster that had a corkscrew, and in the middle he's screaming, "Mom, put your hands up!" So I tried, and it kind of pushed me back a little bit with the centrifugal force. Didn't think anything of it. Got off the ride, was a little sore, but didn't have a headache, wasn't nauseous, didn't feel bad in any way. Came home, went back to work that week, met the family for dinner afterwards. Walked into the restaurant, it was busy. Couldn't find them, so I tried to called my husband, dropped my phone, which was strange, but didn't really think anything of it at the time. Tried to pick it up, dropped it again, thought it was very odd, but found them, walked back to where they were. My older son was waving his hands, trying to get my attention, never saw him.
Brooke joined us at the table and was definitely disoriented, garbling her words, and at that point, we knew something was wrong.
My sister-in-law, who's in the medical field, said, "Stop, sit down, call 911, and I was like, no, I knew there was something wrong, but I was not willing to kind of admit it, I guess. Called the rescue. I walked out of my own power. Within probably 45 seconds, I was talking normally.
At that point, we were questioning, do we still go to the hospital? We made the decision, we're still going to go to the ER and have her fully checked out, so glad we did.
They did take me to the closest hospital and sent me for a CT, where they told me that I had a dissected carotid artery, and they sent me to Rhode Island at that point and had some more intense care, more neurology sort of tests and things. Sent me home about 36 hours later or so. Sat on the couch, and one of my friends came to visit, talked for a few minutes, and then started to garble my words and couldn't speak. At which point my friend said she knew what was going on, and the look on my face, I guess, was, I can't believe this is happening again. My husband called the rescue. The rescue was here within 10 minutes, very, very quickly. After finding out that I was just discharged from a stroke, they got me in the bus as quickly as they possibly could and had me to the ED at Rhode Island Hospital faster than I even know.
Brooke had a severe stroke. This stroke was on the basis of a tear of the artery in the neck, which then sent clot up into the brain. That's the reason her clinical exam was so severe. She was unable to move her left side, she had a drooping of the left side of her face, and she was ignoring the left side of the world, which is why she was gazing to the right and her head was turned to the right. Because of the technology that we can offer to open these blood vessels up, we can now send patients home fully functional, whereas just a few years ago, these patients would be dead or disabled.
If I didn't get to Rhode Island Hospital as quickly as I did, my outcome would be totally different. And I can't even imagine my 11 and 12-year-old sons being without a mom. I was at the right place at the right time. Thank goodness Dr. McTaggart was on that day. The second I was through those doors, I had everybody I needed, between the doctors and the neurologists and the PAs, all the technicians. It's just amazing. And I didn't have to go through jumping through hoops with protocol. And I didn't have to be diverted from one hospital to another. I still can't wrap my head around what happened. 6 months ago, I was healthy and normal, and now I've got this huge life event that's in my rear view. And if I can help further this mission of Dr. McTaggart and just the fantastic work they're doing for stroke care in Rhode Island, I'm happy to do it.
The reason we need to support the American Heart Association is it's the only organization that's dedicated to funding research so we can advance these fields, but it's also the largest organization dedicated to supporting legislation to get patients to the right place the first time in every state. And that's what we're doing here, and we want to see that happen in all chapters the American Heart Association covers and is affiliated with, and there's no organization in the country that is more capable of doing that.
Okay, so you can feel those, go to your group, then discuss it, and
Circle.
Who has no module 4? Jo, may module 4 ka? Module
43-year-old who started metabolic there is a symptom that she's trying to ignore. Parang ayaw niyang paniwalaan.
At the same time, she was in denial, right?
Denial
about the situation. And the soreness, but she did not get it. She doesn't find it anymore. And number 4
Okay, let's go to the second.
Remember the right?
Kasi ano siya, Okay, so we'll say left neglect.
So there was
Kasi right brain yung na-affect. Sorry ma'am, right brain.
swollen.
Right brain yung na-affect. So, right brain was affected. Right brain was affected.
Yeah, that's what I'm saying.
But it was, so when she was on that side,
The phone, yeah. When she was broken,
So it's the swollen of
when she went back then she came out very fast. Although going out, I didn't hear anything that she explained.
What is it? Anyone?
It was everything.
okay, four. Okay, this picture cannot speak. Lagi ko na.
Only the heart. Only the heart.
There was
Okay, sige. Muna tayo. Nursing
hold up.
As a nurse, as a point giver, as a saving, what do you think is the most effective way to intervene?
Next.
The left side.
Anong possible na pwede mong ibigay ng care sa kanya? For example, then ano siguro ibigay sa kanya?
No movement of left arm and right arm.
Titigan mo lang ba siya?
So we're done. Potential. Ano yung effect after? What's the effect of the stent?
What else was the strikes? What's the use of nursing intervention for the patient?
You want to call or separate?
What kind of care? Specific.
So weak, the hand was
Massage. So just like in the video, there was a clarification, right? A clarification
Of the brain.
stroke, right? What was the nurse needs or the patient
So, okay na tayo? Potential urinary problem. Okay, nursing intervention. So, si nursing intervention should go parang ano ka ito, nakakagambay sila. So, nursing intervention and then what is the patient outcome? After you give the intervention, what will be the outcome of the patient? Okay, number one. Management. Low salt fat diet.
Oo. Di ba ano lang siya, severe lang ba niya, di ba? Severe.
Okay, number one natin. Pinaka-importante sa kanya.
Because the brush here and it's on more also. So, okay, let's go.
It's a big factor.
Okay, what do you see the patient outcomes? Okay, will it be?
I think it's a range of
Slash na lang, slash.
Yeah, like for little blindness, like
Okay,
Better said. Listen, boys. Better said, depression is also a factor of different condition. Maybe the cause of or the reason behind this culprit.
okay.
The potential renal problem, we have 1, 2, 3, 4. That's number 1.
Start
The
ba yung
speech will go back to normal.
Yeah, start lang. Parang ano lang, gandaan ba?
Slowly return back down. Okay, the speech. Real slow. Or graduate. I think graduate. Kasi parang
Kasali na din ang diet mo, di ba?
regular medication.
That is for the patient's outcome. I don't know, it's
Okay, regular medications, with regular medications, what's the outcome?
or break guys, the one problem was the situation of the after already that was blind. That was blind.
Do you understand?
We are following we are answering the question what the doctor said. They say the potential follow all the risks of the woman. That was the nurse in the dimension because they
for recovery of mental
Even when you go to the hospital, right? There's no way the instruction will see you without what makes you
Okay, patient outcome. Ano yung outcome sa patient?
Psychiatrist sa
Okay, number 6 pa?
Talk therapy medication.
Wala pa tayo, low salt, low carb diet. Saan yun? Nandito na ba? Regular? Wala pa. Siguro kasama na siya sa saan? Okay, so lagay natin. So we'll put low salt, low carb diet.
I think kulang tayo sa ano, sa symptoms.
For dementia,
Patient outcome.
dementia.
Ano yung blood pressure niya?
Possible to do. Kasi ang madam
Or healthy lifestyle.
preventing like what the nurses do. First they do pressure because they say, oh,
Kasi ano po, dahil po kasi
Remember,
yeah, because
conditions of high blood and or any hyperglycemia. Kasi ganun din. Related to prevent condition
yung physical po, physical appearance niya.
of hypertension. Related naman. Okay. What else? Ganun ako? So, ganyan ba yung regular na tayo ang colors? Sinama ko na dyan. Okay, remember to drink for kasi diba nga may yung device, walking device. Walking device. Yung ginagawa niya, isang Breathing, prevent injury and fall. Kaya na sila mobility, improving mobility, prevention outcome, and using a walking device, or walking aid.
Yes.
Walking device.
Brother said,
It's not close.
Yung dalawang ganyan.
Take a ulit, improve mobility.
Improving mobility.
okay, so
Blindness.
Ito na naman to. Dito na naman tayo. Sign na
Ano pa
to.
po? Okay na ba? Okay. Okay na? Anything to add?
Okay na yan, oy. Hindi naman to.
Okay, so that's
Oo. Kasi from siya.
and supported. Okay, number 8 will be
Psychological.
Psychological therapy.
that is also for the you will use that in
To bring back confidence or the
alright, so
To bring back.
the patient's name is
Different stroke with confidence.
guys, what's the patient's name?
Patient's name, Broccoli. Broccoli.
Brooke O'Connell.
O'Connell.
Okay, anything else? Number 9, emotional support. O, nandiyan na lang.
Nilagay mo na lang dito.
Slash.
Emotional support yung sabi.
Dito na naman yung mga sinunod. Meron ka abbreviation. Sunday ba yan?
Next Sunday, before the class.
Next Sunday pa pala.
So you keep look at this for next Sunday, one will report.
Yan na lang yung i-report ulit. I-report mo tama na yan. Para wala nagbago.
Ano na yung abbreviation?
Abbreviation.
Okay, this one will break. Depression can also be a benefactor of intervention. So the past two things
We're proud of you, Ben. We're proud of you, Ben.
Dahil wala sa inyo si Mervin.
do a mental therapy.
Ano yan siya yung...
So, flat body stroke or skin stroke, sitting down, normally use breath exercise. They can no longer speak right. She cannot be able to walk.
Ito, ano dito? Doktora dito siya.
Hindi ako doktora, no? Grabe siya.
To walk.
Inaral niyo na pala.
Hindi ako.
Okay, and then I will give you assignment. For next week's activity, we will have. Ay, hindi ko pa Okay, for next week activity, we will do admission and discharge. Role playing. Okay, this is role playing. Role playing, the same role.
For Sunday,
For Sunday, role playing, go to your, that is still a part of module, right?
Yes.
Admission and discharge.
Sunday po.
Admission and discharge
Next Sunday po.
next Sunday. So you will have role playing. That will be also by group.
You are still discussing.
Okay, some you can join here in this group. There are only 4. All 4. Yeah. All your assessment is with me. I will sign now.
Bakit yung nakulit si dalawang kapatid sa kayo sa likod, hindi ko po kinuhain sa kanila kasi hindi pa sila nag-practical sa ROM.
Oo.
You didn't check your position. Check your position.
That one I will thank you. You just put hemorrhagic stroke. Yeah. It's not much stroke. Okay, then blood and those
Our range of motion and daily care plan ba na?
Mga ano na to eh, abbreviation ano na. Thank you, ma'am. Pag-practice ang pag-ibata.
Thank you guys. Ma'am, nandiyan yung assessment ko.
Yeah.
Kapag ba yung bukas?
Pwede ba yung
How are you doing? This for this morning.
You're doing all very good.
Sino yan? Sa'yo ba yan? Ate Geraldine. Hi guys. Hi guys. Dinalikuran ng sulit. Dinalikuran.
Saan to, ma'am?
Thank you, ma'am.
ROM and super strict. Maybe next.
Yan yung sa ano,
Ma'am, she
discharge.
said she attended NGT already.
No, I said discharge sa
Not yet. You were in the hospital.
They are, what is this?
At least madi-discharge after, ha? Pag nag-discharge na tayo, nandiyan na yung certificate ng ano caregiving.
What we did earlier was positioning, right?
Yeah.
Wala na siya.
Doon saan? Kaya Lin. Yeah,
Lin?
you done.
Pati positioning po.
Kaya, Ben, kaya pala sa likod ka na, kaya masalamin ka na. Nakakakita na.
Hindi, wala nang space kanina eh. Gusto ko nga dito
Who
eh.
is Sandra? Si Sandra.
Anlin. Anlin Dingdal?
Yes.
Very good.
Sandra. Yung mga positioning na, babalik na naman sila.
Natapos ba yan?
Kasi yan, personal hygiene, tayo, kali. Personal hygiene. Sandra ka na? Personal hygiene.
Sumaya.
Diba tapos na tayo?
Somalia, yes. Somalia.
Sumaya. Not yet.
Ay, personal hygiene naman natin sabi. Pasok tayo bukas din.
Wala kaming IV pa, no? Wala kayong IV? Ha?
Wala yata sila.
Wala pa kayong priming?
Ako ba wala last time? Kasi nahuli na ako.
Pero nga ako na ano.
IV Friday. Oo, kanina.
Si Jung nga nag-IV na eh. Si nalito na ako. Okay, so after na
Oh, it's okay, ma'am.
Oo, wala pala.
Pag naman yung ano, diba? Yung mga backlog.
Yan. Ikot-ikot lang. Or ano? Like a Monday, Friday, Sunday. Either kasi minsan yung NGT last week, hindi na pati. Anong Friday? Anong Friday? Friday.
Five now.
Bukas anong oras? Wala ba bukas?
Feeling better? Feeling better? I got out of hospital today. I saw ko sa
Mamaya ka po yun sa akin.
Ibig sabihin, iba yung CG. Iba yung ano yung personal hygiene. Uulit tayo niyan. Okay na lang yan kasi easy na lang sa ating alam na natin.
Nagubat si Ate Stella ng camera.
Alam mo.
Okay, wala naman makikita.
Ha? Wait. Aryan. Maria. Olania. Sumaya. Rowena. Kerian.
Okay, ito yung mag-opera sa akin natin. Let, tingnan mo yung opera sa akin.
Daily care plan? This one.
Before ng birthday ko. So, ibig sabihin birthday ko, dala-dala ko yun.
Yeah, that is
Last year.
daily care plan. Like I make it a nursing care plan.
Please to have 10 dirham.
Meron ka rin?
Wala ko kayong wallet.
Wait lang, sister. I will check. Wala din pala akong pera dito, gyatay. No, I don't have sister. Oy. Mahirap.
Maybe I have points because I'm poor. Maybe I have because I'm a poor person.
I-video ko nga ito.
I have 10 here. Here.
Hi guys!
Thank you very much. Thank you.
Oh, you can watch you can watch this video to my YouTube channel, okay? Yeah, it's live.
It's live. Yes, it's live. Okay.
You can watch, if you want to watch, just subscribe.
What's your YouTube channel?
Oh, what's your YouTube channel?
What's your YouTube channel? Nandoon to eh, yung kanina ginagawa natin. Nandito, live to kanina.
What? Follower in
No, it's Joe.
Joy Encarnacion. Yeah.
Joy Encarnacion.
JHO. Convert to natin. Convert.
It's the thing.
Convert na si Convert to natin.
Mami.
Oo.
Yung mga mali-mali.
Kita na natin sinong mali.
Mali ako eh. Sige.
Sa, ano ang pangalan kuya mo? Christopher.
Hindi ko kasi nalilip-up.
Titignan ko.
Palit to.
Langanin pa yung kanya eh. Oo. Ako, ako direct yung PM mo.
Diretso ka.
Wala ka tulog eh.
Ayan sila.
Ano dear?
Yours.
Wow. Look at sa'yo, Ben.
Don't go because I have to give you, what is this, materials. Yeah. Don't go.
Ilan yun ang ano sa
Ano sa'yo?
Journalist.
Yung NGT, ma'am, yung NGT lang.
personal hygiene? Hindi sa, ano pa daw yan sa atin?
Yung buha ka na uniform?
One year?
Buha ka.
Yung one year?
Ano po ba? Mandatory ba uniform? Hindi naman mandatory. Pero sa graduation, magkano kayo? Kasi may kailangan.
Ano yung ganyan yung nagpunta?
Oo.
Magkano
ma'am yung credit? Pwede ba sa late, ano ka na lang, yan yung second? Oo, sa para hindi ka na ano ng BLS, tapos na sila. Meron po ang sa BLS. Ay, si Mary Jane pala. Ano ba yan?
Ma'am, ako ma'am. Kaya ata gantok ma'am.
Oo nga eh. So, magsasabay na lang po ako kasi, di ba, yung enroll ako, ano ko. Sasabay na lang ako. Hindi na ako makasit sa ibang araw. Dito ka na. Ano ba ang... Off mo naman ngayon, di ba? Opo, Sunday lang po available. Oo, every Sunday at kasama ka. Sunday na lang po mama no.
Every Sunday. Tayo doon. Lahat tayo.
So, lahat naman po yung babalikan ko.
Tapos ako dito, yung one care po. Tapos na rin, pero wala ka.
Huwag mo na kayo manis, meron mo mga ano, materials. Na sugar straight, no?
Magkapareho kami, wala kami.
Ito yung nagano na eh.
Ano po wala? Yung IV.
Hindi pa pala.
Kami ilan pa. Ang mga 5 kami, 6. Yung mga bago. Last week. Sige lang ma'am, marami.
Uniform. Iwan talaga yung uniform.
Kami si Christine at saka
Sino ang nag-ano ng group dito?
Christine.
Wala sila lang. Grabe sila.
Dear, what's your name?
Dapat kasali mo sa mga LC. Dito ka ma'am, sali ka dito kay class.
Dyan na lang.
Ganito ma'am, ito yung teacher namin. Pwede ba ma-record?
Pwede.
This is a class picture.
Ano yan? Video yan. Oy, video yan. Mag-present muna kayo. Our teacher. Si mag-present muna.
This one, our teacher.
Hi guys! Si Inay teacher! Hi guys! Si Inay class po eh. Si Inay class.
Sunday group.
Picture lang.
Picture. Dapat sabay tayo na sasabihin.
Oo nga. Okay. Sa Inay combo. Ano yun?
CSA.
Sunday.
Sunday group.
CNA Sunday group.
Okay.
This is
We are.
as muna.
1, 2, ready, go.
CNA Sunday group. And this is Mom Elsie. One of the best. The best teacher. Okay, picture. Okay. Picture yan. Guys.
4, 3,
Okay. One more.
Dito pala naman.
Yung mga lalaki wala.
Saan sa bedroom, ha?
Yes. Meron. Okay. Kung ano yung sa YouTube, nasa YouTube yan. Ito. Ito. Ayun o, nandito. Naka-live yan, live.
to.
Sa YouTube.
Shout out kay ate. Shout out.
Joe International TV.
Okay? Just keep that. That is how to administer medication.
Ano yan yung i-discuss natin? Hi guys! We're done.
Hindi ka pinayan ng
La. Ano nangyari sa Kate? Kulang pa.
Bakit kami dito, ma'am?
Hindi lang yan.
Open it.
Ilo yan. Pero ay na lang.
Sayang ang
Yan. Ano yan? Bakit lang? Hindi mo maglaro. Ang daming input. Bye guys! Thank you.
Are you going? Yeah. You will order uniform? Oh, ito. Small mo. Small? Ay, tingnan mo, ha? Meron akong isa ditong small. Yan ang kay, ano.
Hindi tayo ng PDF.
Hindi naman itim.
Parehas yan sa tingnan. Kasi baka hindi sila magpapalit nung magpapalit kasi sila nila. Oo, ito nga.
Ano magpapalit ka ng uniform?
Magpapalit na kayo. Madam, this boy is very big.
You were gonna do the...
Madam, medium, yes. It's big. You're madam at home? Yes. So you want to change? Yes. It's big. You want to say, ay, maganda po, ma'am. Ang tanto nga taas. Maganda siya, ma'am. Maganda siya ang katumakot sa taas. Ma'am, ganyan din yung small ko? I think it's okay. Then wear shorts?
Ay, shit, Kay.
Yes! Habibi.
Nalagyan mo ako. How does it change?
All the papers.
Hindi pa ito mabumili.
Dami papel.
Ha?
Hindi pa ito bumili naman.
Hindi naman pero mas maganda na kayo nito. O ano kaya yun natin yan?
Ano ba tayo sa Tuesday?
Ito.
Bigay
Para sa yung ano, yung dalawang mag-prepare for. Sa akin na lang yung small.
Saan ka nakatala dito ba?
Ano gusto nila? Gusto mo ito, Lynn?
Madami sa kanila.
Anong kailan yun, ma'am? Dapat lahat kunin. Kasi
Oo, lahat. Ano yan? Yan ba yung sa akin? School mo ko, yan yung small.
Ba't wala ka ng small?
Grade 2 eh.
Ha?
May TV eh. Vlog yung ginagawa.
Ano will exchange uniform?
Vlog yung ginagawa. Oo.
You will have it now. Buy again? Ito na lang kunin mo. May ganda.
Ano yan?
May zipper siya dito.
Small yan.
Oo, tingnan
Palit
mo.
mo na lang.
Thank you. Ano oras na?
Ngayon,
Malaki?
Hindi, yung video.
151. Okay na sa iyo.
Lunchtime.
Kaya mo na
Medium.
Sinukat mo yung small.
Hindi pa nga eh.
Maliit mo.
Magkaiba kang tela na.
Nagaano siya nagmi-mismatch.
Magkaiba yung tela.
Ito ka kaya, Lynn? Okay na.
Wait,
Kita kaya sa live.
Makita ang ano.
Nagka-cardio pa naman ito pampasayig sila to eh. Kasal ka na.
Magpapalit ako ng I think it's too small.
Too small.
Extra small.
Medium lang. Okay na yun.
Bakit ganyan?
May zipper na siya?
Ay, iba yung style niya.
Ay, sana all may zipper.
Wala kang zipper ni Kuya. We want that. I like that zip.
Yun sa'yo, nasa
Mami, di ba pwede naka-adjust?
Ayun, sumunod ko kahapon.
Ano pa, Ajma?
Ito kami.
Pang ano to, pang
Oh, ayan guys, si Mayor. Oh, si Mayor.
Subscribe to my channel.
Yung channel ka na.
Hindi rin ko pa.
To be fair.
Hindi kasi small dito ang medium. Small sa baba.
Hindi, small sa taas.
Medium sa baba.
Maganda yung uniform nila. Version to version.
Ganito ang uniform doon sa rehab.
Wow.
Rehabilitation. Ganyan na. Yeah. Nurses at saka nursing assistant ganito.
Ate kulay, ganito.
Ganito na ganito. Yung isang estudyante dito doon nag-work, nagagamit ka na. Yan yung uniform.
Len. Niligaw ng taxi.
Naligaw ako ng taxi.
Kailan?
Isang araw.
Niligaw ng taxi. Parang gabi pa yata. Madilim.
Ano na?
Ko ng Saka maglalagyan ka lang. Ayan o.
Yung nagpa-sobra kami sa nirefer mo, hindi daw
Saka mas magandang
Pwede ba nabayad namin dito? Kami namin sa installation namin.
Di ba man magagamit to?
Yan yan ang sa rehab.
Follow-up
Pag nag-ano ka, kailangan straight ang matawag.
So ano na? Okay na kayo?
Okay na ba?
Okay na. Wala naman akong choice. Magkaroon ng flight.
Pero iba yung kulay yung leave me.
Tingin?
Manay,
Okay ka na?
ko po. Parang isa yung dark, isa light.
Parang magkaiba nga siya ng kulay. Kasi yung isa, alam mo yung una kong cake. Parang
Maganda siya.
Parang may dark.
Ito dark
Hindi siya napupuspaw.
Tama ba ito? Kalat ba? No? Parang baligtad yung pagkatayo.
Okay ka na ba?
Hindi. Maiksi lang din siya.
Yeah, do here. We will
They don't know yet. Miss Elsie, kung paano yung gagawin. Hindi pa nila alam. Kailangan nilang panoorin muna.
Ay, doon na sa naka-close na.
Ito na.
Doon sa, there.
YouTube.
You watch first.
You watch first.
Watch nila. Yes.
Shall we?
Okay. Kailan ka mag-BNS? Parang ano ba yung schedule? Sino wala pang module 4? Ba't ang dami pang module 4?
May modules, do you have module 4 now? Module 4, no?
Suggest mo sa kanila kung nalagyan nila ng pages ang module. Parang madaling mo.
Patient ako ng
And okay. Tara, ma.
Bye!
Bye,
Let's
mom.
go!
Guys, we're finished now. We're done. And thank you for today. Ma'am Elsie, thank you.
Thank you.
Kamusta?
Bye-bye.
Subscribe Ma'am Elsie Paradihas channel, guys.
Yeah, very informative.
Yes.
Bye!
Bye, ma'am.
Pasok kami ng CB.
Oo.
Tuesday. Personal hygiene ba?
Oo. Sige. Tayo, Jo.
Oo.
Anong day yan?
Tuesday.
Opo, Tuesday.
Personal hygiene?
I will show you.
Oo, kailangan natin yun. Kailangan natin yun, Bin eh.
Iba na yung sige kasi.
Ma'am, that's our teacher, guys. The best teacher.
Live ba niya?
Oo. Ma'am Elsie Pradihas. Ayan, pride. Filipino pride. Oh, and this is the beautiful ano.
Beautiful talaga. Kakagaling ko nakaka-discharge ng sa hospital.
Bye, guys. Tara na. Susunduin
Oo,
ka.
pupunta raw siya.
Ah, sige.
Sabi ko, sige. Dalawin na lang kita, te.
Okay.
Miss
Bye-bye ka
kita.
na.
Yan na kita ano na lang kita sa sa schedule.
Sige, pasabihan nyo na lang po ako.